Welcome back to Talk Jamaica here in Talk Jamaica Radio. We are streaming live on talkjamaicaradio.com, carrhythms.com, and Zeno Radio. You can listen to us as well via the Talk Jamaica Radio app, which you can download free from the Google Play Store. My name is Ralston Chamberlain.
Good afternoon again, listeners. Good afternoon, Mr. Chamberlain. My name is Ricardo Brooks. Fire Fenton Ferguson fast. Those are the words of the youth arm of the Jamaica Labour Party, Young Jamaica. The organization says it is alarmed that 18 babies had to die before the minister and his technocrats addressed the matter publicly. Young Jamaica says that in any other self-respecting country, the principles of accountability would require that Dr. Ferguson be removed from office. They are also questioning whether there was an attempt to cover up the deteriorating conditions at the University Hospital of the West Indies and the Cornwall Regional Hospital. However, in a sharp response, the People's National Party Youth Organization, PNPYO, lashed the opposition and its youth arm, telling them not to politicize healthcare. The PNPYO said in a release that the opposition must, quote, immediately remove their favorite politically colored lenses and call a spade, end quote. The organization explained that Klebsiella is well known as one of the most common hospital bugs causing possible fatal illnesses worldwide. The PNPYO said that it is alarming but not strange, coming from the JLP and its affiliates, the absolute silence with regards to bringing the responsible senior staff at the UHWI and or Ministry of Health to book. The organization added the JLP's record on health is far from stellar, and so throwing stones while living in a glass house is foolhardy. Listeners, to tough it out, to discuss their various positions, we're joined by the heads of both organizations. Andrae Blair, he is the president of the People's National Party Youth Organization, and Howard Chamberlain Jr. is the president of the Jamaica Labour Party's Young Jamaica. Gentlemen, good afternoon.
Good afternoon, and thanks for having us.
Not a problem. Let me start with you, Andrae Blair. You say that the JLP shouldn't politicize healthcare, but the general consensus I am picking up in the population is that somebody ought to be held responsible for this. Can it be reasonably considered politicizing healthcare to demand accountability?
No, well, it's not considered politicizing if you're demanding accountability. Accountability is absolutely something that has to be demanded. However, and I want to take the opportunity to say, Ralston and Ricardo, that where the deaths of young Jamaicans are involved, it is something that is very unfortunate. And we'd like to use this opportunity to extend deepest and sincerest condolences to the families of those who lost those babies. But however, when first the story was reported, even I was alarmed because the impression I got was that here was a situation in which babies were dying in the public hospital as a result of an unknown bacteria or an unknown infection. That was something that was very alarming. So it is important in having the discussion that we have the discussion based on disclosing what are the full facts associated with this particular incident. And the facts surrounding the case is that the 18 who died were, number one, premature babies that were weighing less than 2 pounds, that came in premature less than 7 months old, who are highly susceptible to infections, and their rate of survival at that rate and at that level is severely low. In addition to that fact, and this is a testament to the hard work of our healthcare professionals, under very trying circumstances, the infant mortality rate in Jamaica comparable to other places in the world is fairly good and is trending down.
Mm-hmm.
That is commendable.
Mm-hmm.
And I want to
Howard Chamberlain,
your healthcare professionals for achieving such great feat under challenging and difficult circumstances. So, with those facts being placed on the table, it is important to understand that what happened, while alarming, while unfortunate, should not be classified as a major outbreak, so to speak. And could it be possible, being that the minister was not informed, could it have been possible that the technocrats and the technical people and the healthcare professionals at the varying hospitals having been able to take what they consider to be corrective actions under these circumstances, maybe have not considered it necessary that the minister ought to be informed. Because
Andrae, let me just ask Howard. Howard, we heard Andrae there outlining the fact that, as a medical matter, this really ought not to be causing this much alarm. He mentions, for example, the fact that children were prematurely born, and that we see worldwide where these outbreaks happen. And your organization this week mentioned that you accused the PNPYO, in fact, of gross insensitivity in the fact you said that they were covering up the tragedy under medical speak. Could you explain to the listeners why that was the position taken?
That's exactly what the PNP is doing, because we've been hearing the posture from the PNP and from all the health professionals that, these babies are a part of the statistics. These babies are premature and their rate of survival is a little bit low. So, it's unfortunate that they die, but, they would have died perhaps because of the mortality rate. Let us not be alarmed because, this is just an outbreak and it happens all over the world. And Jamaica is within, the expected number of, the countries that have these sort of outbreaks. So let us not be too alarmed. While it's unfortunate, it's nothing for us to be alarmed. That's a posture that we're getting from the PNP and the Ministry of Health on this important issue. It cannot be that you have mothers now having, born the pregnancy for a number of months, at the point where you're going to deliver your baby and your baby has died because of some sort of outbreak that the hospitals and the health ministry could have curtailed, and now they are deceased as a result. They are just a part of statistics. That cannot possibly be the posture that's coming from this government. And that is what is so much annoying to the Jamaican people and annoying to us as the opposition.
Andrae?
Yes, but while it is a sensitive matter, I don't think that in the discussion we can ignore what are the medical facts. And no one is saying that it is not sensitive. No one is saying that we don't feel the pain and the hurt associated with the mothers of these babies. No one is saying that we ought not to send out condolences to the mothers involved. Also, no one has said that when the outbreaks occurred, that no corrective action took place. So that is also important. They also need to establish whether or not the healthcare and technical professionals at these hospitals actually took the necessary corrective action in a medical situation as the one which we were faced with. So to give the impression that at the individual hospitals there was an outbreak of a bacterial infection and no corrective action was taken, I think that is misleading and we ought not to give that impression. That is very important for us to state and for us to make that clear and for us to lay that on the table.
But let me ask you this, Andrae. Let me ask you this.
That the JLP and the Young Jamaica is playing politics with an emotional issue. What they are trying to do, understanding that the death of young Jamaicans is something that is very emotive, understanding that a mother under those circumstances, having lost a child, is grieving and is in an emotional state. Yes? Understanding that no amount of facts and no amount of statistics can be comforting to that mother. So we understand that it's a sensitive issue. And a sensitive issue of that nature ought not to be one on which we are to seek political mileage. What is it that we ought to do? We ought to discuss the issue dispassionately. We ought to look at what are the facts involved. We ought to look at what are the conditions under which our medical professionals operate and under which they have been able to get commendable results. And we ought to look at what concrete and tangible steps we can take to improve those conditions within the context and the framework within which we operate.
What's quite political with this issue? What's quite political with this issue is that we continue to have political acts within the health ministry as technocrats and in different sensitive positions. What is very political about this issue is that we continue to have a failing health minister that exudes no sort of confidence to this country, and we continue to have him for some sort of political mileage as a health minister. We have to look at this issue into context. The issue is that this bacteria is caused because of a failure or lack of resources and failure on the health the hospital to sterilize the rooms properly. The president of the medical association came out and told us and paint a picture of the bad state of the health system, where even the very soap that they're using to wash up and to clean up after, they have to be, throwing a half out into a bottle and putting water onto the rest, or where they don't have any, they have to use the regular antibacterial soap that you probably find in some supermarket or wholesale somewhere. And instead of the minister doing an audit and presenting that audit to the Jamaican people so we can see exactly what are the issues in the health sector, he has sought to hide it and to discuss it among himself. Even when this issue broke out, instead of the minister and the health ministry coming to the Jamaican people and telling us what the issues are, you heard that we have found the issue and we are dealing with the issue. What is the issue? We don't know. It's way later on we're hearing that there's no bacteria, that 42 babies were infected and 18 have died. It cannot be the standard of health care in Jamaica. Before you jump in, Ralston, we must understand that the system of whether or not we have a good health care doesn't only concern the Jamaica Labour Party or the People's National Party. This is a national issue to ensure that our society is safe and healthy and that our system can provide for us, provide for our health care needs.
And I'm glad you have gone there, Howard Chamberlain, because one of the questions I want to put to you, and given that you have outlined that we have a system that is underfunded, yes, we have a system that where, as pointed out by the JMDA, certain things that are supposed to be in the hospitals are not in there. Would you agree with me, Howard Chamberlain, that as we have come to this place because we have free user fees instituted by the Jamaica Labour Party?
And that is what the PNP wants Jamaica to believe, Mr. Chamberlain. That is what the PNP wants Jamaica to believe. Look at the statistics of it. A government ought to decide what are some of the basic services that it can afford its citizens. We have a situation that there were a lot of people in this country who were sick and were afraid to go to the health center and the hospital because they did not have the money to access health care. So we had a barrier to the access of health care. The Jamaica Labour Party under Bruce Golding freed that up to ensure that the ordinary Jamaicans have access. The little old woman, when her blood sugar and her blood pressure ought to be checked and she needs the necessary medication to dress a sore foot, she can walk into a health care and access that service free of cost. The government now needs to look into what is it that the health sector is missing and see how best we can help it, and stop cutting the budgetary allocation for the health sector. They have done it under the IMF program, and that is what is crippling the health sector in this country.
Ralston,
respond for me, Mr. Blair.
Hello?
Go ahead, Andrae. I want you to respond to what Howard has said.
I am extremely happy that you raised the question you raised, because it's a very important and significant matter. Because number one, what is it that we want as a people where healthcare is concerned? We want access, number one. We don't just only want access, but we want access to good quality healthcare, number two. In order for us to get that access and for us to get that access to good quality healthcare, then there are certain aspects and there are certain financing arrangements which are necessary to put that in place. I would have hoped, and just to correct something that Howard said earlier, about cutting financing to healthcare. In the previous budget, the highest allocation ever made to the health sector in the history of Jamaica was made under this People's National Party government and under the leadership of Dr. Fenton Ferguson. Talking about access and talking about the leadership of the very same minister that they are calling to be fired is the same minister that has led a revolutionary program in improving our secondary healthcare facilities all across Jamaica, who has upgraded Type B to Type A hospitals to again get to that point of not only giving access, but to ensuring that you try to improve the quality that is access. That is very important. The very same minister who's under his leadership has acquired 18 new ambulances and has 19 more on order. I would have liked if Howard was equally passionate under the 4 years of the Jamaica Labour Party's government and not new ambulance was brought into Jamaica. Where was his passion at that time? Where was his passion when they removed user fees from hospitals and did not go on a program of having any upgrade to our secondary facilities? So that very same old lady who he speaks of in rural Jamaica can have access to high-quality health care in the health centers that are very close to them. This is the very same minister who has been leading this charge in the health sector, whom they are now calling for his resignation. Understandably, we would have liked for Minister Ferguson to have shown some more sensitivity in dealing with the Chick V matter. In this matter, with the 18 babies who died, as he said, he was not informed until last week Friday, and as soon as he was informed, he took particular action. You have to understand that these are sensitive matters, and the sensitivity behind it as to how you communicate and how you deal with it is also important. But if we look at it in a dispassionate way, and we look at the totality of his leadership over time, over this 4 years since he has been appointed health minister, credit also has to be given to his leadership in trying to revolutionize and transform secondary health care in terms of improving the quality of the care that we gain access to, whilst maintaining the no user fee policy. Because Howard made an erroneous statement earlier that financing to the health sector has been cut. That is not true. What is going to happen is that we have maintained the no user fee policy while increasing the allocation to healthcare so that more money can be spent on improving the quality of the care to which Jamaican citizens have access to.
Andrae, one of our listeners is asking you.
We would have heard of the signing of contracts in terms of the implementation and the upgrade of neonatal intensive care units. And that was in train before this recent story broke. So there was a recognition that there is need for improved facilities to deal with our neonates.
And I wonder if Andrae would agree that there's absolutely no confidence in the health system right now.
Let me
I wonder if Andrae would have agreed with us that Fenton Ferguson has been an absolute failure and nothing that Fenton Ferguson can say to the people of Jamaica will ever believe. I wonder if he can agree on those simple points. I wonder. And if this notion and this argument that the minister wasn't told until Friday, that can't fly. What kind of party shop government is it that we're running? I guess the Prime Minister don't know anything about the situation. That's why she hasn't commented on the issue, not even her condolences and some sort of, emotions towards the dead babies that we have in this country. Nothing at all. I bet she doesn't know either. Because it don't seem like anybody in this government knows about anything that is happening in this country.
Let me ask you this, Andrae. A listener is asking you whether you would support the government ending the free healthcare policy.
I think that's a discussion that we ought to have dispassionately as a country. I think we ought to have a system in place in which those who are not able to pay are not denied access to health care. That is important. But user fee is only one aspect of access to health care. There are other services that people access to which has to be paid for. We need to transition the debate to a stage where we start looking at whether it is time for us to get to a country or get to a place where we say universal health insurance is a policy where we need to institute. Those are the kind of discussions that we need to get to, where it is that when people need to get access to high quality health care, is that cost is not a prohibitive factor. So just limiting the discussion to merely talking about just the no user fee policy. I think under our financial constraints, if we are in a situation where some people can make a contribution, we ought not to preclude them from making that contribution. But at the very same time, those who are not able to pay and are not able to afford it ought not to be denied access to the health care that they need. So that is one thing. Transitioning the debate now to looking at how do we institute and implement a system where we can start having a discussion about universal health insurance coverage. That is one thing. Also, in light of the current budgetary allocation, which primarily goes to capital expenditure, how can we establish a set of funding that is going to be geared at now capital projects that are going to be looked at significantly improving the quality of our healthcare facilities and our healthcare plans? Those are the types of discussion that we need to get to, and not come here like Howard, blowing off hot air and blowing off hot steam and trying to appeal to the emotion of the Jamaican people. The Jamaican people want access to very good, high-quality health care.
Andrae, another listener here is saying
workable solutions to ensuring that they have access to that problem. We need to have a dispassionate discussion and find workable solutions and practical policy solutions to those problems. That is the discussion that we need to have.
Right. Andrae, another listener is here is saying, and I'm trying to get as many of them in as possible, is saying to you that you sound very aloof and insensitive to the plight of the people who are suffering. How do you respond to that?
So that is government.
The very first statement that I made in the conversation, I said that no amount of statistics can take away from the pain and the hurt that the mothers of those 18 babies who died is feeling. No amount of justification and no amount of saying that this is a normal health matter and a health procedure can take away from their pain and their hurt. And anyone who also read our release in its totality, the very first point that we made was that we extended our condolences to the families of those involved. We could not be insensitive to the plight of 18 of the youngest Jamaicans dying. That is the most unfortunate and a very sensitive matter, and we feel the pain of the people involved. But I am also equally saying is that understanding that the people are hurting and understanding that it is an emotional issue, what we ought not to do is to also now try to play politics with that level of emotion that people are feeling and to now try to score political points on the backs of people's negative emotions.
But let me ask Howard, because
before Mr. Chamberlain, before you jump in, what I'd love to happen is that the government starts by restoring some sort of confidence in the healthcare system. And one of the biggest barriers to achieving that confidence is Fenton Ferguson. And there's absolutely nothing that the government can say to the people of Jamaica but to give us the resignation of Fenton Ferguson. But what is also equally troubling, Mr. Chamberlain, was that the chief medical officer was alerted this outbreak on the 7th of September. She took 14 days to respond, Mr. Chamberlain. She responded on the 21st of September when she indicated to the hospital that 2 officials from the Ministry of Health would follow up on the matter to ensure the appropriate inspection. Another baby died on September 20th. And October 5th, that's the day that some help came from the Ministry of Health. Where the hospital received a letter indicates that a team from the Kingston and St. Andrew Health Department would be visiting to conduct an assessment on the unit. Where they found that another baby was diagnosed with this sort of disease. This is what we're talking about. It is not about politics. It's about dealing with the issue front on.
But let me ask you, Howard, because one of our listeners is saying to me whether
I have not heard one mention of what it is that we need to do to improve our neonatal intensive care units. I have not made him make one mention of what it is that we need to do to improve our report.
You have no conversation about that until you give us the resignation of Fenton Ferguson. If you want to have a serious conversation about the healthcare system in this country, restore the confidence, get rid of Fenton Ferguson, and let us talk.
But Howard, let me ask you this, because one listener is asking if, just a minute, Andrae, I want to...
All that you're able to do is to call for the resignation of the minister.
Give us Fenton Ferguson resignation, we'll speak.
Why were you not calling for the resignation of the minister when your government was in power, when that person did nothing to improve the conditions of the healthcare sector under which we now operate?
Give us the resignation of Fenton Ferguson, just like how we're asking for the resignation of the President of the Senate. Give us the resignation.
Come, gentlemen. Come on, gentlemen. You've been well behaved so far. Rostan has a question.
I want to ask Howard, because one of our listeners is saying, is it not, just a minute, Andrae, let me get this in. Is it not hypocritical for you to be saying that the Prime Minister has not offered condolence, yet we have not heard any condolence from the leader of the opposition, so except to say that they are outraged and that Mr. Ferguson should resign? Isn't that hypocritical on the part of the opposition?
The opposition leader, on a number of occasions, he has expressed condolences to the family of those who have been affected by this terrible outbreak. On a number of occasions. It might not have been in the official release that was sent from the party, but on a number of occasions and different forums that he spoke, including at the Prosperity Live in Portmore, the leader placed on record his condolences to the families, including Desmond McKenzie, the opposition spokesperson on local government. We even had a moment of silence for those families who have been impacted because of the outbreak.
My final question to you, Ricardo, is Howard, is this. If the Jamaica Labour Party should form government, do you think that we need to look at this whole issue of no user fee, and would the Jamaica Labour Party be willing to say those who can pay should be asked to pay?
Well, I don't know the position of the Jamaica Labour Party as it relates to that issue. But what I will tell you is that what we are concerned with in the Jamaica Labour Party is the whole issue of access to health care. So if it is that reviewing and probably instituting a health insurance policy will be done in such a way where the vulnerable of us in the society will continue to have access to the health care, then that is something that they'll be prepared to review. But right now, from where I stand, I do not know the position of the Labour Party on that particular issue.
And our producers is giving us the wrap-up signal. And so, gentlemen, in less than 30 seconds, I'm going to ask you, starting with Howard, where do we go from here? What the Jamaica Labour Party wants to see?
First and foremost, we need to restore confidence in the healthcare system. Fire Fenton Ferguson and fire him fast. That is the roadblock to confidence in the system, you know. The entire country, they have lost all sorts of confidence in Fenton, confidence in the healthcare system. Give us his resignation. Then immediately after, we'll have to do an audit, a proper audit of this healthcare system. I suspect one is done, but I don't know under what conditions because we haven't had the report. Let us see what the issues are so that we can move together to fix them. Whether public-private partnership is required, tell us the issue so that we all can be a part of the solution.
And Andrae, you hear Howard calling for the resignation of Fenton Ferguson. Where do we go from here with a health system that is obviously seemingly in trouble?
Where we go from here is that we develop workable solutions to the problems that we're facing. Where we go from here is that we look at how we are going to develop comprehensive health insurance for all Jamaican people. Where we go from here is we look at how we're going to practically improve our healthcare facilities to ensure that people not only have access to healthcare, not only that they can afford to pay for that high-quality healthcare, but also that we improve our healthcare situation significantly so that people have that access that we want, that good quality access that we all desire as a Jamaican people. And we're confident that in the next election, the People's National Party government will be returned, and we will continue on that path to not only ensuring that people can have access, to not only ensure that those who cannot afford to pay will still have access, but to also ensuring that we significantly improve the standard and the quality under which we operate, so that the quality of the access that people have is access to high quality healthcare.
Andrae Blair is the president of the People's National Party Youth Organization, the PNP. Howard Chamberlain is the president of the Jamaica Labour Party's youth arm, Young Jamaica. Gentlemen, thank you very much for what was a very, very insightful and strong discussion. Thank you so very much for joining us.
Thank you for having us.
You're welcome.
All right.